patient today asked about obsessive compulsive disorder, and I thought that I would talk a little bit about obsessions. Obsessions are thoughts or images that come into someone's mind that may be strange or inappropriate and actually bother the person. They cause significant distress to that person, and yet the person has difficulty getting rid of those thoughts or images, and they will repeat, and they may repeat over and over again, or repeat throughout the day for that person or for substantial periods of time. And again, these thoughts or images, as I mentioned, they may be strange or inappropriate. So let's say that someone is in a relationship and they're really not sure about how things are going, and they're thinking about that a lot. That wouldn't be an obsession. Or if they are unsure about their work or stressed about finances, and they're thinking about finances or their work a lot, that wouldn't be an obsession. So again, obsession is a repetitive thought or image that may be strange or inappropriate, but really bothers someone and causes significant distress. These can be in a lot of different categories. Sometimes obsessions can be violent in nature. They can be sexual in nature. They can be religious in nature. There are several other types of obsessions. Some examples, and by the way, and when I go through some of these examples, you'll see why some people are pretty embarrassed by these obsessions, and they may not even disclose it to people because they're worried that the obsessions say something about their personality or about their character, when in fact the obsessions are just a symptom of a treatable medical illness. It's not the person's fault, and it doesn't mean anything about their character that they have these kinds of thoughts. So an example of an obsession: someone's walking down the street and they have the thought that they might blurt out some profane word in front of a crowd and really embarrass themselves or really upset somebody, when they're not the kind of person that would do that. But they actually will really worry or be scared to be in social settings because they think they might actually do that. Or when they're in their kitchen and they're having some dinner and they pick up their utensils, they have the thought or image that they're going to take that fork and stab themselves or stab someone else with it, when they're not a violent person and they really are at no risk of doing that. An individual might have the thought when they're at a high place, they look down, that they would actually jump from that place and try to hurt themselves, when they're not suicidal at all and really can't imagine why they would have that kind of a thought. Someone might also have the thought that they're going to get contaminated by an illness. They might be worried that they're going to get HIV when they're not sexually active and aren't engaged in any behaviors where would put them at any likelihood of getting HIV, for example, or another illness. So these are all obsessive thoughts that can cause a lot of distress. And again, don't say anything negative about a person, their character, or anything like that. They're just a symptom of a treatable medical illness. And if someone is struggling with any of the symptoms, it's important that they reach out for help.